And here we go. Welcome everybody to The Big Idea. Today we're going to be talking about a pounding, pulsing pressure in the brain. And it's the kind that oftentimes is going to overlap if you're having troubles with your stomach with your autonomic nervous system or your vagus nerve, or maybe having pain on the face or pain on the tongue, pain in the throat. We're talking about these kinds of things, and we're going to be looking at a few MRIs where we sometimes see that there's an abnormality with blood vessels, and that's actually what's producing some of the symptoms. Number one, what's actually going on? How do you find it? But number two, and arguably more important, what are the options so that you know what you can do to help manage these different kinds of issues? Let's have a look at it. Okay, first up, I take you here to what is probably one of my favorite slides that I showcase on this channel frequently here, of what's called a phase contrast MRI. Let's go ahead and click that play button there. Okay, so the image that you have on the left, this is what we routinely see when we're looking at a static MRI of the brain. So we're looking at a side profile here just to give you a bit of orientation. Nose is over here, mouth, eyes would be right here, upper parts of the brain, and this black thing is going to be the brain stem, ultimately becoming the spinal cord right here. And on a static picture, you don't see what the reality is. Your brain is actually a living, breathing organ that, as you can clearly see here, oscillates about up and down like this, about a centimeter with every beat of your heart and with every breath that you take. And you'll probably also notice all of this white stuff that's around it like this. It's what's known as cerebrospinal fluid. It is the stuff that's going to be supplying the oxygen, the energy, and all the stuff that your brain needs in order to work the right way. If that system is ever corrupted, this thing ain't going to work the right way. But I also want to draw your attention to something else that I don't routinely showcase in this particular video right here. You may also notice there's this moving little black thing up and down kind of right along right here. What this is known as is the basilar artery. See, it's not just the cerebrospinal fluid, but the arteries and also to a certain degree the veins inside of your brain, they also pulsate with every rhythm, with every beat of the heart, and with every breath that you take as well. And for some people, unfortunately, it turns out that is what the problem is when they're experiencing a lot of these weird symptoms. And oftentimes it's not discussed on standard MRI reports. Let me explain why that is. All right, I've got a horrible picture here of some of the major blood vessels that are supplying blood to the brain, particularly the brain stem. And it's what's known as the vertebrobasilar system. In brief, you've got a pair of arteries that actually transmit directly through the vertebrae in your neck. So this is coming up from the spinal column here, and then along the front of the brain stem right here, it's called the medulla, we'll come back there because it's important, is they're going to combine and they're going to unite to form this basilar artery, which in turn is going to be supplying blood to the back part of the skull, parts of the middle part of the brain, and also all the vital life systems that keep you alive in the first place. Now, on this silly little diagram that I have here for you, it's shown the way that we like to showcase things in anatomy textbooks. That is where everything is perfectly symmetrical. The kicker is that the vast majority of us human beings, we are different on the left side of our body and the right side of the body. We are also different on the outside and also on the inside. Blood vessels are no different. And this is a well-documented phenomenon. All of us in the health field, we know this, that sometimes people have a really big artery on one side and a very small artery on the other. That in and of itself is not a problem because the brilliance and the wisdom of our body is able to find plumbing bypasses and ways, simply put, to make things work. The kicker, though, is that every once in a while, some of those abnormalities, they mean that certain people have a smaller margin of error. And the consequence of that is the accumulation of years of that, years of accumulated physical stress, mental stress, chemical stress, all of that can sometimes make these little variations become clinically significant. And in particular, when you're talking about something that's affecting blood flow to the base of the skull and to the brainstem itself, which is where all of your vital life centers are, it can start showing up in some really, really weird ways. And let me show you what that looks like. Okay, it's a phenomenon that's known as a dolichoectasia. All of us in the health and the medical world, we like using big words because it makes us feel important. It's a fancy word that means that arteries have like a weird tortuous shape to them. And again, by itself, that is not a problem. And that's why this stuff is oftentimes not remarked on, whether seeing a neurologist or a radiologist, because we encounter this stuff all the time. But every once in a while, again, when you're looking at the whole of it, so not just what do you see on the pictures, but also what are the nature of the symptoms that you are experiencing, that's where, okay, we have to start considering the possibility that these normal benign variants are actually causing a bit of a problem. So what I have here is a little video, and it's going to kind of go through in little slices here, so we'll cut back and forth, but I'm just going to start playing it right here. And I'm going to showcase, just to give you a little bit of orientation, so we're looking as if bottom up, so left side is over here, right side is over here, and it's going up and down just a wee little bit. So this structure that you see in the back, so this cauliflower-shaped thing here, that's the cerebellum, the balance coordination hub of the brain. So it's in the back of your head right here. The brainstem itself is going to be located right here. And then I'm going to draw your attention to those two little white circles. Those are those vertebral arteries where they're normally coming up along the base of the skull, base of the brainstem like this, and where they are normally going to unite midline and then start to ascend as one artery across the front. But as you probably just saw right there, and I'm going to let it scroll back here for just a sec. So this is starting low, right about here. So you'll see that the two arteries are right here. But as we're going up, this guy on the right zigs hard over to the right side, and then this guy, they unite, and then they form across the left side. I'm going to jump ahead a little bit because this is the exact same individual here. So normally where we would expect for this artery to be sitting straight midline, what it's actually doing is it's butting directly up against the brainstem itself. And in this particular example here, I don't know if you can make this out abundantly clear, but if this is midline of the person's head right here, it's actually physically pushing the brainstem over and off to the side. This is the same individual, and the colors are actually flip-flopped here. So the spinal cord and the brainstem, this is that grayish thing like this. The fluid around it is white, and then this black thing right here, that's the artery. And I think you can see, you don't need a trained eye or years of going to school to see this. That brainstem, it's not just kinked, it's canked. It's hard going off to the side. And that's not going to be a good thing. Again, this is just looking at it on a static image, but let me take you back to that very first picture. Remember what we said. Everything on the inside is oscillating like this. So when the arteries are pulsing, they're not just sitting up against the cord of the brainstem like this. They can actually be pulsating and smacking against it like this. Now, if I was simply poking you in the arm once or twice, you're probably going to punch me, and you're not going to be very happy with it, but think of it like water torture. If your own anatomy unfortunately sets you up where there's a decreased margin of error, and every beat of your heart, that artery is bumping up against the neural tissue at that level, that can really start to irritate those parts of the brain that are directly in the firing line. Here I've got for you then two other examples. The reason I'm doing this video is I've actually seen a recent slew of these. So we have a different individual here. So again, the cauliflower stuff, this is the cerebellum. The brain stem itself, so the medulla, is this guy right here. And the dark black, this is the vertebral artery on the left side, on the right side. And then here it is on the left. So again, the asymmetry of the arteries, this is very common. That is normal. But as you can see, this guy is kind of pressing right up against that part of the brainstem right there. That's potentially not a good thing. This image that I have right down here, this one was shared with me by a colleague where it was remarked on as being, it's like, okay, this one's kind of a really, really big deal. This was the most pronounced version I've ever seen of it. So back of the cerebellum right here, brainstem here. So you see that that artery, not only is it pushing it, but it's actually dragging it all the way across to the other side. Now, the reason that this stuff matters is because this is the medulla. This is the stuff that's directly in the firing line. Your medulla or your brainstem, it's no bigger than the end of your little finger. And it is responsible for a huge amount of things that go on in your body. So number one, it's the filter that dampens the pain signals that are coming up from your body at all times, filters them out so that you can function as a normal human being, but also so that you can sleep at night. It also is going to process all of the information from your heart, your lungs, your digestive system, all the info going up, and also all the information going down. And it also regulates the blood flow in every part of your body and also the brain itself. Now, I'm not going to read all of this stuff out here for you at you. That would be most dreadful. But depending on where it might be that that artery is kind of bumping up against and irritating the neural tissue, people can have all kinds of different symptoms that are associated with it, and it's different from person to person. So I'm not going to again read all of these, but what we're talking about firstly, this would be if that artery was pulsating against the back part of the brainstem. So these ones right through here, these are involved with vagus nerve function. So heart, lung, digestive system, that kind of stuff right through there. Also a little bit of a hormone and immune system. That's if it's on the midline. If it's on the back but on the side, I'll point out here, so what's called a nucleus ambiguus, this is swallowing, and also a trigeminal lemniscus and medial lemniscus. These are going to be conduit pathways for sensations up to the brain, particularly as they relate to balance orientation, but also sensory information on the face. And it's not uncommon when people do have some of these weird things, you could do a few simple tests on your own. Number one, if you have weird sensations on your face, either pain or decreased sensation, you can, number one, stick your tongue straight out. Your tongue should go in a straight line, but if you are trying to stick your tongue out straight and over-exaggerate, grossly over-exaggerate, if the tip of it starts going sideways, that means something is not working at that part of the brain. It's a little bit harder to see, but in case you ever wonder, why is it when I go to the doctor, they have me open up my mouth and say, ah, as big as I can? Yes, they're looking for infection or inflammation on the back of the throat, but they're also looking to see if your back palate, is rising symmetrically. If it isn't, that usually means that something is affecting the function of the vagus nerve. Again, that's the guy that's sending all of the information to and from your vital life organs. So if you're seeing, it's not working right on one side, it's not rising, that's a sign, okay, your neurology is not working the right way, and something in this part of your brain is most likely being compromised. So that's if you have irritation on the back. Now, if you have it more in the front, and this again is different from person to person, but this would be more representative of those examples that I showed you where the artery was butting against the front parts of the brainstem here. What is this going to involve? So this is going to involve what's called the accessory nucleus. This is the guy that's responsible for being able to move your shoulders. So oftentimes people, if they do have facial pain or other types of neuralgias, things like that, they'll oftentimes say, oh, it just feels like my neck is always in such a terrible knot. It feels like it's spastic on one side. These guys right here, these are conduits for vibratory sensations that are going from your body up to the brain. So oftentimes people will describe issues in either their hands or their feet, when the problem isn't actually coming from there, it's a transmission error that when it's getting up to that level of your brain, garbage in and unfortunately garbage out. Lastly, then, if we've got issues kind of along the front but on the outside, these were called tracts. This again is all about the information about body position sense, pain, temperature regulation from all parts of your body. So again, transmission errors are oftentimes a critical issue that we see with people when they have these kinds of anomalies. So I pause here for just kind of a big picture idea. Oftentimes in the body, it's not 100%. People experience more than one symptom at a given time, but it usually doesn't make sense that a person has a dozen or so different breakdowns in their body. Instead, what's far more common is that you have one or maybe two issues, and what it's doing is it's showing up in multiple ways. So if and when a person is experiencing maybe an issue with the low back, and then a little bit of an issue with the neck, but then also a little bit of something around the jaw or with the head or the face or brain fog or something like that, most likely the issue is closer up to the brain as far as its origin goes. You need to be looking here because the rest of that stuff, again, not always, but oftentimes is a downstream effect. We need to focus to see what's going on up here. Now, I've done plenty of other videos, and I'll continue to do them to showcase for you guys some of the weird things that, again, we commonly see on MRIs, but again, are not reported by the neurologist or the radiologist. Again, why? Because these asymmetries of the arteries, they're very common. Not every person who has that is going to have these particular kinds of symptoms. But if you do have these kinds of symptoms, even though it doesn't represent a discrete pathology, it is possible that if you've got a disrelationship or an issue in the systems of your body, that can cause it to become symptomatic. And as a result, we can't rule out the possibility that we need to address that as good as we possibly can. Now, we cannot change a person's architecture. So again, when people, whether something is hereditary or genetic, we can't change your bone structure, we can't change your genetics. It's more a matter of then, okay, well, what can be done to accommodate your body as much as possible? So even if you have a small margin of error, you can widen that margin of error. And even if you still do have a little bit of that abnormal artery, if you can give it even a millimeter or two of extra wiggle room, more functional space, that oftentimes is enough where your brain is essentially able to say, oh, thank you. This is not perfect, but we can work with this and you can start feeling better. So a few things as it relates then to this dolichoectasia. So number one is going to be blood pressure control. Ideally, this is done through diet, but there is a time and a place where proper medication is also important because again, and think of this in terms of blood pressure, blood flow. If you're looking at the patency of the arteries and it's thump, thump, thump with every beat of your heart, you don't want it slapping against the brainstem there. So if you can normalize blood pressure, that goes a really long way toward keeping things under wraps. Now, a couple of things on blood pressure regulation that I should also hit on. When you're looking at the two numbers, you know, you have the blood pressure cuff on, and ideally 110/70 or 120/80. The two numbers are important, but the truth is that it's the difference between the numbers that matters most. So the difference between the two should be about 40 millimeters. In other words, that's how much it's rising. If you are at 130/90, the difference is still 40. So overall, not too bad. Now, also important to know that as all of us age, blood pressure commonly does start to go up. So 140/100, not common. Now, of course, the higher it starts going beyond that, then that means that, okay, that pressure gradient, even though it stays the same, there's less flexibility and there's more resistance of the arteries. And again, this is oftentimes why, even though we have these different types of asymmetries, it wasn't causing issues in the first many decades of your life. It's more like compound interest that builds up over a period of time. And as your body loses that flexibility, that's where you start to get symptoms. Now, fortunately, there's a difference between chronological age, you can't control that, and your biological age. So this is what things are like on the inside. So cardiovascular activity. Diet, reducing inflammation, all of that in all of its ways goes a long way toward maintaining and keeping a healthy blood pressure. And I do add again, it's outside of my scope of practice, but this is where certain types of blood pressure medication, or really whatever it takes, can be useful in the long term, because otherwise it can be where the situation is going to be worse than any medications. Now, number two to that are conservative types of care. So these are going to be things that can help your body accommodate better from a flow perspective. And there's no one size fits all here. So one possibility, firstly, physical therapy. This includes speech therapy, and this also includes different types of neurological rehabilitation. In other words, if there's problems that are start affecting your neurology, giving your body more tools so that it's able to accommodate for that, so it's not creating the same level of problems. Number two, cranio-cervical therapy, whether it is focusing on the head or base of the tailbone, anything that facilitates normal flow of all that white stuff, that cerebrospinal fluid, goes a long way toward reducing turbulence and maintaining balance on the inside. Same goes then with my line of work, upper cervical chiropractic. If you can make sure that the top two vertebrae of the neck, they're moving, functioning the right way, that goes a long way toward reducing some of that neurological tension, facilitating flow so that brain can work and body can work as good as they possibly can. Also, what's known as a functional neurologist. Again, not just the discrete neurology, and again, time and a place for medication, but also giving your brain a few extra hacks and bypasses to be able to accommodate for some of the neurological symptoms that you might be experiencing. Now, beyond that, and these are the kind of conversations that nobody admittedly likes to have, but of course, if you're dealing with a condition that is making your life absolutely miserable, even if it's not going to kill you, if you are suffering because of this, then you have to consider upping the ante here. Now, I am also not a surgeon, so I cannot tell you exactly how this is done. This is just what's available in the research. So number one is what's called a microvascular decompression. In brief, it's a surgical procedure where they make a little keyhole incision, and around a blood vessel, they're going to put a little bit of Teflon. In other words, it's going to, as opposed to that artery slapping against the neural tissue like this, it's going to create a little bit more space here so that it can glide without producing friction. It's a very common procedure for people who experience a certain form of trigeminal neuralgia, but it's also performed if and when you can identify, yeah, you've got an artery that's butting up against the brainstem right here. Now, this is a little bit more invasive, but there's another procedure that's known as an arterial repositioning surgery. So this is where they go in, and what they're doing is they're actually trying to move things a little bit more. This is not just done by any old neurosurgeon. These are talking like world-class experts, because like I showed you, when you're looking at the neurology of the medulla, you don't want to get any of that stuff wrong. So this is usually reserved kind of as a last option if you've already gone through all of the different kind of things. But wanting to give you guys a little bit of explanation first and foremost as far as, well, what's the nature of some of these issues? How do you find it on an MRI? But then what are some of the different treatment options to keep things under control, from the conservative first to the surgery as a last resort? So truth is, I wish that I could say that these kinds of things were always quick, that they were always easy. Here's the one magic solution that fixes it all. Unfortunately, it's not always true. And oftentimes it means that people need to do a lot of different work to get things back under control. It's not fair. You didn't do anything to deserve this. But in the same breath, there are a lot of options that can be done to help out. So again, we're talking pulsing, pounding, pressure in the brain. Important to look not just for big, dangerous, scary things, so lesions, tumors, all that sort of stuff, infections, but also looking at some of these functional disturbances, because if you can at least identify these are what the most likely culprits are, it gives you the opportunity to know what you can do or what kind of healthcare you need so that you can improve your overall quality of life. Thank you guys for watching. I do hope that you enjoyed this. If you did, please, as always, make sure you click the like, subscribe button. Even if this video doesn't register and you don't want to see all the stuff, it goes a long way toward helping other people find this information if they are looking for it. And please, if you've got the friend or the family member or the colleague who's experiencing something like this, share this with them so that they might know what options are available to them. And if you want any more information about the type of work that we do in our practice, what we can do to help, you can visit us at clearchirospokane.com. And you can also check out any of the other videos, blog articles that we have on that site, give you a bigger idea of what we can do for you. Thanks again for watching. This is Dr. Jeffrey Hanna at Clear Chiropractic. Get well, live well, stay well.